Hello everyone, my name is HUMAIRA binti ZAHARI, and today me and my partner NURUL binti ALIPAH will be discussing about online counselling and face-to-face counselling for individuals with communication disorders, the advantages and limitations. For today's topic, we will first begin with the introduction. After that, we will look into the definitions of online counselling and face-to-face counselling, and then we will go straight into the advantages and limitations of these two. Then we will talk about the conclusion, and lastly, our references for this presentation. From children to adult, individuals with communication disorders often demonstrate mental health concerns. Research shows that they are often associated with anxiety, withdrawal, low mood, and behavioral frustration. Apart from that, they also struggle socially and emotionally. For example, they may experience peer rejection or social exclusion, which in turn impact their self-concept and emotional. Although speech-language pathologists often reported concerns about their clients' affective states or behavior problems, formal mental health referral processes were inconsistently applied, and only a few multidisciplinary care plans were implemented. Within speech-language therapy settings, the absence of routine emotional well-being screening has been observed. This calls for future SLPs to integrate more holistic approach by including routine emotional well-being checkup during the session. The implementation of more holistic approach can be achieved by acquiring knowledge and undergoing additional counseling training. Most of student SLPs demonstrate confidence in exploration and action skills, but lower confidence in emotional support and insight skills. By undergoing additional counseling training and having longer professional experiences, student SLPs may achieve higher self-efficiency not only in counseling but also in clinical skill. In short, SLP students need to have the right counseling knowledge and skills. There are many types of counseling which are divided into different aspects such as approaches, purpose, and methods. But today, we will be discussing specifically on the advantages and limitations of two methods of counseling, which is online counseling and face-to-face counseling. Let us first discuss about the definition of these types of counseling. Online counseling is the delivery of therapeutic interventions in cyberspace where the communication between a trained professional counselor and client is facilitated using computer-mediated communication (CMC) technologies. They are also known as teletherapy or telepsychology. Meanwhile, face-to-face counseling is when a counselor sees a client in a private and confidential setting to explore the difficulty of what client is having. It could be the distress that they may be experiencing, or perhaps their dissatisfaction in life, or a loss of sense in direction or purpose. Face-to-face counseling has always been a thing. It is also known as traditional counseling. But during the COVID-19 outbreak, online counseling services were advanced as they are the only means of attending to mental health conditions, especially during the lockdown. A quite number of studies has compared face-to-face and online counseling, and they have pointed out similarities rather than differences. Both of them can help the clients to build empathy, support, and self-disclosure. Online counseling experiences a higher degree of disclosure, whereas face-to-face counseling experiences a higher degree of satisfaction and sincerity. There is no significant differences when comparing empathy, positive regard, building deep relationship, and self-disclosure between these two. In conclusion, online counseling is as effective as face-to-face counseling. Now, let's look into the advantages of online counseling. Firstly, online counseling offers economic advantages because it reduces costs such as transportation and time of work. In the case of individuals with communication disorders, it can help lift their caregiver's burden. For example, a caregiver of a child with speech delay does not have to travel frequently to a clinic, which saves both time and money. Secondly, online counseling is very convenient and accessible because the clients can attend session anytime and from anywhere as long as they have internet connection. For instance, someone living in rural area or busy working adult can easily schedule a session without needing to travel long distances. Furthermore, online counseling also helps reduce stigma. Some people may feel embarrassed or afraid of being seen entering a counseling clinic. With online counseling, they can receive help privately. For example, if a person is dealing with anxiety, they may feel more comfortable when speaking to a counselor through a video or chat instead of going to a clinic. Finally, online counseling can also provide effective care as effective as face-to-face counseling. Many studies have shown that it works well with issues such as stress, anxiety, and mild depression. For example, a person experiencing a work stress can regularly talk to a counselor online and just learn coping strategies without needing in-person sessions. In the context of communication disorders, of course, online counseling can still provide effective care. Therapists can guide both the individuals and caregiver with strategies and exercises that can be practiced at home. For instance, a speech language therapist can coach a caregiver through communication technique during a live video session, allowing immediate practice in a natural environment. Now, let's move on to the limitations of online counseling. So firstly, online counseling relies heavily on technology. This can be a major challenge for individuals with communication disorder, especially if they are already struggling to express themselves clearly. For example, a client with speech sound disorder may become frustrated if the internet connection is poor, as the interruptions can make their speech even harder to understand. Secondly, there are limits to the type of care that can be provided online. Some individuals with communication disorder may need more hands-on support, visual cues, or specialized tools. For instance, a child with autism spectrum disorder (ASD) may benefit more from in-person sessions where the therapist can guide interactions directly and use physical materials. Another limitation of online counseling is communication restrictions. Online sessions, especially those without video, which is texting, they reduce non-verbal cues such as facial expressions, gestures, or eye contact. This can make communication even more difficult for individuals who already have challenges. For example, a person with aphasia may rely only on gestures or visual support, which are less effective or harder to notice online. Another limitation of online counseling is privacy and confidentiality. Because the session takes place over the internet, so there is always a risk of data breaches or unauthorized access. For example, if the platform used is not secure, then personal information or conversation could have been exposed. In addition, the clients may not always have private space at home. For instance, someone attending a session in a shared house might feel uncomfortable speaking openly if a family members or roommates are nearby. Sometimes the technical issues such as recording, hacking, or accidental sharing of information can also affect confidentiality, which reduces the client's trust and willingness to fully open up during the session. Now, I will pass my presentation to my partner, NURUL.
Assalamualaikum and hello everyone. My name is NURUL binti ALIPAH and I will be presenting the advantages of face-to-face counselling with individuals with communication disorder. First, communication disorder allows better observation for non-verbal communication. This is important because individuals with communication disorder often use facial expressions, gesture, or body language to express themselves. Therefore, meeting in person helps the counsellor to understand more about the client clearly. Secondly, it helps to build the strong therapeutic relationships. When the counsellor and client interact directly, it creates a more comfortable and trusting environment which encourages the client to communicate more openly. Next, face-to-face counselling allows accurate assessment and immediate feedback. The counsellor can observe the client's speech and behavior directly and provide guidance or correction during the session. Finally, this method can fewer technological barriers because it does not rely on technology, internet connection, or digital devices, which can sometimes interrupt online session. Now, I will move on to the next slide, which will discuss on the limitation face-to-face counselling. Now, I will move on to the limitation of face-to-face counselling for individuals with communication disorder. First, face-to-face counselling may have limited accessibility for individuals living in a remote area. Some clients live far from the clinic or therapy center, which make it difficult for them to attend regular sessions. Secondly, there can be time and scheduling constraints. Both the counsellor and the client need to arrange a specific time and physically attend the session, which may be challenging for those with a busy schedules. Next, face-to-face counselling may involve higher financial costs. Client may need to pay the transportation and travel expenses, which can increase the overall cost of therapy. Finally, there may be environmental and mobility challenges. For example, individuals with physical abilities or transportation difficulties may find it hard to travel to the counselling location. Next, I will move on to the next slide, which will show the comparison between online counselling and face-to-face counselling. On this slide, I will compare face-to-face and online session in terms of accessibility, comfort and communication. First is accessibility and convenience. Face-to-face sessions are less accessible, especially for people in the remote areas because they need to travel to the clinic. Online sessions are more convenient since the client can join from home and save time and money. For example, a parent living far from the therapy center may struggle to attend weekly session but can easily join online session. Second is comfort and environment. Face-to-face sessions take place in a professional setting, which helps the client to stay focused. However, online sessions happen in familiar environments, making the client feel more relaxed and open. For example, a child may feel shy in the clinic but more comfortable speaking at home. Third is the communication. Face-to-face allow full use of body language, eye contact and facial expression, which helping counselor to understand emotion better. Online session may miss these non-verbal cues, especially with poor quality of video or audio. For example, small behavior like fidgeting or avoiding eye contact are easier to notice in person. Next, I will continue with the connections, privacy and effectiveness. First, connections. Face-to-face sessions usually create stronger therapeutic relationships due to direct interaction and fewer technical barriers. Online sessions may feel weaker due to issues like unstable internet. For example, a lagging video may interrupt emotional sharings and reduce connections. Second is privacy. Face-to-face counselling is confidential, but some clients may feel nervous being seen or entering the clinic. Online counselling can feel more private and anonymous, encouraging more people to seek help. For example, a teenager may prefer to call to a therapist from their bedroom rather than going to a clinic. And lastly, effectiveness. Face-to-face sessions are often better for severe or complex cases, while online sessions can still be effective for mild to moderate issues or follow-ups. Like a child with severe behavioral difficulties may benefit more from in-person therapy, while stress management can be handled online. In conclusion, both methods have advantages and the choice depends on the client's needs and situations. In conclusion, both online counselling and face-to-face counselling have their own advantages and limitations, especially for individuals with communication disorder. Online counselling provides greater accessibility and flexibility, making it easier for the clients to attend sessions from anywhere. For instance, someone who has transportation difficulties or a tight daily schedule can still join sessions without needing to travel. On the other hand, face-to-face counselling allows better interaction and observation, which helps the therapist to understand communication behavior more accurately. Therapists are able to pick up a small nonverbal cues such as changes in posture, facial reaction during in-person session. Therefore, the choice between online and face-to-face counselling should depend on the individual's needs, abilities and available resources. Thank you. The following reference were used in our presentation. That is all from us. Thank you.